Hi, my name is Nathan Ruby, and I am the Executive Director of Friends of the Children of Haiti. And I'm here to just give you a quick update of what's going on in Haiti right now and some of the things that FOTCOH is doing for earthquake relief. But first of all, I gotta say, wow, what an amazing response so far to this disaster. I have been overwhelmed with phone calls and texts and emails and messages and just giving support and asking where people could help, and the financial gifts that have come in has just been amazing. And so I want to say thank you on behalf of FOTCOH, on behalf of the people we serve. What an amazing response it has been. But I got to say, I'm not really all that surprised. You know, FOTCOH is a family. And when a family is in trouble, family responds and family steps in. And that's what has happened. And as a family, we go from Dr. Nelson and Boyer and all of our Haitian staff on the ground, to our US staff, to our board members, to our volunteers, to our donors, to all of our constituency. It is family, and it is amazing what family can do when they come together. And so I just wanted to say thank you so much for everything that you've done. It does make a difference. So, all right. So what is FOTCOH going to do going forward? And I want you to understand something about working in a disaster zone. And there is one constant that is always present in disasters like this, and that is that there is no constant. We're working in a dynamically changing environment, and organizations like FOTCOH make decisions based on the facts that they know. They make a decision, and then we move forward on that decision. But those facts may or may not be valid later today or tomorrow or next week or next month. So the things that we do right now may not be what we do as we go forward as the facts change. All right. But as of today, as of right now, this is what we're doing. And I want you to think of it as a three-legged stool. Our first leg, and this is our first response, we're already in process of this, is through our WASH program, our water, sanitation, and hygiene program. And what we're doing is we are delivering fresh water filters to the impacted area in Lakai. And the specific filters that we're using are, they are small, they're compact, they're mobile. And water filters, fresh water, is really important in a disaster like this because it's essential to people's health and survival. Safe, clean, portable water helps families to wash their hands, to have access to clean water, to brush their teeth, and other hygiene needs. And the filters we use are Sawyer filters, and they are particularly valuable because they're small, they're portable, they're very easy to use. And our team, Boyer and our WASH team, was scheduled to already be in Lakai, which is the main city, the larger city that was impacted by the earthquake. However, we had a bit of an issue, and that was a thing called Tropical Storm Grace. And Tropical Storm Grace came through Monday night, Tuesday, and dropped about 10 to 12 inches of water on top of us. And it slowed down our response time. So, and that's Haiti. Our response to an earthquake was hampered because of a tropical storm. And that's just the situation that we work in when we're in Haiti. So, but they are on the road. They'll be going later today or tomorrow. And they'll be distributing those filters. And so that is the first leg of our stool and our first response. Our second response is going to be something that we have been doing for 30 years, and that is taking care of our Haitian patients in and around Cyvadier and Jacmel. We have thousands of patients who depend on us. They depend on our urgent care being open on Saturdays. They depend on our vital health care clinics to open. They depend on us to have the medications that they need. They depend on us to have the supplies that they need. And we will be honoring that as a priority. So we will continue to care for the adults and children and families that we always have with top-notch, high-quality healthcare and healthcare education. So that is the second leg of our stool. The third leg of our stool is actually going to be also through our acute care response, which is we also call our urgent care clinic. And in disaster areas, you have the initial response. The earthquake has happened, and there are crush victims, and there are wound issues, and there are thousands and thousands of people that are in pain and are hurting right now. And there is a response to their needs in a crisis situation. But long after the cameras leave, weeks, months, years down the road, there is a need for ongoing wound care and crush care. And not only that, but just the primary healthcare needs. The medical system in the Lakai area is overwhelmed and is going to be overwhelmed for a long time to come. And so what we are doing is we're connecting with organizations in Lakai that we can partner with, where they can bring their patients, their people who are suffering to our clinic to be taken care of at our clinic in Cyvadier. And if we need to expand our acute care operations, if we need to be open longer, if we need to add more days, if we need to increase our patient count, that's what we will do to take care of that need through the partnerships that we are in process of developing. So that's what we're doing. Our clean water program through our WASH program is one, continuing to care for the patients who count on us and have counted on us for years. That's two. And then three is using our acute care, urgent care clinic and working with partners there in Lakai to take care of the needs of earthquake victims for days, weeks, months, years to come. So that's our three-legged approach. And lastly, what can you do? Well, there's three things that I'd like for you to consider. First of all, your thoughts and prayers. It works. It is important. And I want you to know that that is important to us, and ask that you continue to offer those. Second is getting the word out, helping people to understand what's happening in Haiti, helping to understand what the Haitian people are going through, what FOTCOH is doing as a response, what other organizations are doing as a response. One simple way to do that is through forwarding our social media information and liking it and putting it off, or sorry, I'm not sure what the social media term is, but sending that on to your networks, to your family and friends, that is most helpful, so that we just have more people to know what's happening. And third, your financial gifts make a difference. The funding that is coming in now is allowing us the flexibility of adding additional water filters and gearing up with more medicine for the patients that we know are going to come, more medical supplies that we know for patients that are going to come. So your gifts help us be prepared, help us to gear up for the increase in patients that we are going to be caring for. So continuing to keep us in your thoughts and prayers, letting people know what's going on down there, and your financial gifts. Those are three things that you could do to tremendously help us. So thanks much. Thanks for listening. I'll be back with you in another day or two and let you know an update and what we're doing then. Thanks, and we'll talk to you soon.